We're also tracking an alert from the CDC on what's called multi-system inflammatory syndrome, or MIS-C, and 3 suspected cases of that rare childhood illness here in Colorado tonight. Health experts believe it's tied to COVID-19, although they're still researching why it's just hit kids between the age of 5 and 15. News 5's Colette Bordelon following up for us tonight after she first told us about this last week. She's live at Children's Hospital with the latest tonight. Colette?
Children's Hospital Colorado is actually one of the leaders in the entire country when it comes to researching this new syndrome. Doctors here have been studying similar illnesses for decades now. Here's what they say parents should know to keep your kids safe.
It has a correlation with those who just got over COVID-19.
Symptoms of MIS-C showing up in some kids weeks after having coronavirus.
The first cases of MIS-C were reported in countries throughout Western Europe only a few weeks ago.
Now just over 100 cases in the States.
We have seen it in individuals up to age 20, and it often affects teenagers.
Symptoms of the syndrome include a fever, rash, abdominal pain, vomiting, puffiness of the hands and feet, and red eyes.
While the syndrome is, again, seldom fatal, it often requires clinical intervention, and it can cause lasting heart damage as well.
The new syndrome has been compared to Kawasaki disease, another rare inflammatory illness.
But one of the big issues is that most of these kids with the MIS-C are above the age of 5.
Sean Logan's son has Kawasaki disease, and he says it typically hits kids when they're younger than 5.
Kids with this new syndrome also are much more likely to have severe abdominal complaints, have heart problems and blood pressure problems compared to children with Kawasaki disease.
Children's Hospital is ready to treat patients with either inflammatory illness.
It is important for parents and providers to be on the lookout for kids with potential MIS-C and Kawasaki disease, as both likely benefit from earlier recognition and treatment.
With Logan hopeful that the attention on MIS-C helps raise awareness about Kawasaki disease too.
What triggers MIS-C and what triggers Kawasaki disease? And if we can get research to figure out if there's a correlation there, I think that will be exciting.
Children's Hospital stresses to call your pediatrician if you see any of these signs in your child, because the doctor's office or the hospital are still safe places to be during this pandemic.
This puts me in a really bad position.
When asked if MIS-C could change plans for daycare or school in the fall, Governor Polis says he doesn't know enough about that yet to be making that call. He did point out that people over 65 still are at the greatest risk. Always watching out for you, Colorado Springs. Colette Bordelon, News 5.